Hey, welcome to Connect Safely Live. I'm Larry Magid, and my co-host, as always, is Kerry Gallagher. I'm the CEO of Connect Safely. Kerry is our education director, and our guest today, and I'm very excited about that, is Amelia Vance with the Future of Privacy Forum. I'm turning around to read her bio. She advises policymakers, academics, companies, districts, and states on child and student privacy law and best practices. Welcome, Kerry, first of all.
Hi, thanks, Larry. So good to be with you. I'm really excited about today's show because this is the part of these circumstances that people aren't talking about enough, I think.
That's right. And Amelia, thank you so much for joining us.
Thrilled to be here. Thanks for inviting me to be part of the show.
And we're going to ask you about this later, but thank you for inviting us into your home. Which brings up some privacy questions that I think Kerry is going to bring up later. But let's start by talking about what is the Future of Privacy Forum.
So my organization is a nonprofit that works on consumer privacy issues, particularly those where the law isn't quite settled yet. So I run our child and student privacy work, and my colleagues explore issues like connected cars, health data outside of HIPAA, location data, pretty much anything you could think of in privacy world right now. So it's a ton of fun. We try and put out useful information. And I personally work with schools, districts, states, ed tech companies, policymakers, and others to try and provide information about what laws are out there, where the gaps are, and what are best practices and lessons learned.
You know, privacy and student data privacy is always a big, important issue. And it's one of the reasons why, full disclosure, Connect Safely and Future Privacy Forum have collaborated on two booklets, a student data privacy booklet aimed at parents and one aimed at educators. And Kerry also worked on that project with us. But right now, there is a huge elephant in the room, and it's called COVID-19. And it's really important when it comes to privacy because there are a lot of privacy implications when it comes to this pandemic, because let's face it, knowledge, including knowledge about people's status, is a very important tool for public health authorities and for all of us to stay safe. And knowledge, sometimes disclosure is great, but disclosure sometimes runs right into the issue of personal privacy. So in broad terms, and we have a lot of specific questions, but in broad terms, talk about your thinking right now about what this pandemic means when it comes to personal privacy as well as student privacy.
So we've been exploring and talking to a lot of policymakers, academic and advocacy organizations working on privacy about what are the key issues here. And it's been remarkable because so many people have said the same thing. 3 months ago, we would have never been talking about making people download an app that shares their location. 3 months ago, we never would have been talking about turning over so much information to a particular company or to the government. 3 months ago, we were, on the verge of potentially having some sort of federal consumer privacy law that would have been fairly strict. And this public health crisis has changed a lot of the thinking here. Not to say that privacy is any less important, but that it really shows that there's a lot of nuance because privacy is very important, but you also want to make sure that you are containing the pandemic, that you are as much as possible preventing people from being sick, identifying cases, all of the things that the scientific experts have told us, which means that you are infringing a bit on people's individual privacy. And so it's really bringing some nuance to the broader privacy conversation as we look at exactly what are the parameters here and how do we balance privacy with ensuring we do what we need to do to curb the pandemic.
Excellent. And we're going to really dig into several of those areas that you just listed, Amelia. So we're really lucky that you're here as an expert in this area. A first question I have, and this I think really speaks to, it doesn't matter who you are or what you do. We have done more video conferencing in the past month and a half than I think as a society we did combined in the years prior to that. And since a lot of us are video conferencing from home, I have 2 kids and a dog at home. And so I've decided that my office is now located at a standing desk in the corner of my bedroom. So whenever I'm video conferencing, this is, you know, one of the walls of my bedroom that people are seeing. And it's required here in my house because it gives my children the rest of the house to use. It ensures that they have freedom of movement. They need the space. I need the privacy while I'm working. But what are the privacy consequences of us basically giving people literally a window into our private places, our personal spaces?
I mean, that's such a great question. And we may actually, I don't know where my cats are, but we may get a Zoom bomber at some point that really illustrates how difficult it is to have private spaces when we have to do the day-to-day work, but we're doing it within our homes. We're, you know, having our solitude invaded. And in terms of how that could violate privacy, I mean, what's behind you, what people see really could say a lot about you. So to, you know, turn the spotlight on myself, I have very nicely set up my bookcases behind me. And, you know, there's a very special book set that says, you know, I like investing in book art. There's, you know, some young adult novels that I grew up with that I love enough to have hardcover versions of. And so now you all know I'm a fantasy YA geek and, you know, like Irish sayings on teacups. And so you just learned a whole bunch about me just from the cues around my location. And while I am happy to geek out and proudly say that I am a geek about those things, that's information that you could have gotten if someone had just taken a picture of this and stuck it online. And that's a lot of information that you just learned that a lot of people may not know about me. And that is heightened when, you know, someone is in, you know, a one-room, a studio apartment, when they're sharing a location with family and others, because there's so many interactions in our life that we were able to do privately in person before this. Therapy,
you
conversations.
You anticipated my next question, but I was going to make a comment. Kerry, you and I have been working together for 5 years. Even though you live in Massachusetts and I live in California, I have twice been to your home and you have been to my home. I have never been into your bedroom before. I've met with you and your husband in your kitchen and your family room and your kids and all that.
Yep.
But the point is that it's not only your bedroom. I'm sure it's a bedroom you share with your husband as well. And
correct. Yes.
so you not only have to think about your own privacy, but his as well. And like, for example, Amelia, you mentioned books. Your books tell me a little bit about you. If you were to come into my book, you can see some of my books, and you can see I have an old typewriter, an old telephone. Still says something about my age, because these are all things that I owned when they were new.
Life magazine over there.
I have a Life magazine and other things. If you were to go into our library where we have most of our books, you would know something about my political views, things that I don't generally share with the public. And so there really is a lot of very rich information in our homes that we might want to protect. And again, I've had the pleasure of having a Zoom bombing session when one of Kerry's kids walked into her room. But fortunately, she was appropriately dressed, and it was more funny. It wasn't at all embarrassing, but it could be embarrassing. In fact, my wife has walked into my office, not improperly dressed, but not looking her best, not thinking that she was about to be on television. So we need to think about all those things.
Absolutely. It's so important that, especially when we're talking about, I know we're going to get to sort of school-related questions later, but as we're thinking about how employers or how teachers are requiring students to turn on videos or requiring their employees to turn on videos, what are you making people disclose? What is the level of discomfort that they may feel or embarrassment when you're making them show, you know, the walls behind them versus the walls behind classmates or other folks. So it's something that really hasn't been talked about a lot, but it is very important.
Yeah, I totally agree. So we've talked nice and broadly. Let's sort of start narrowing our topic. Wanted to talk a little bit about some medical privacy questions, and then we'll really narrow that to how that applies to schools and children who are at home right now in their families, but learning academics and still connected with school. So firstly, a lot of us have other medical concerns that are not related to COVID-19 and need to contact our doctors or dentists. And so we're starting to rely on telemedicine, which existed before all of this, but we had the option to engage in it or not before, right? So what are some of the implications of telemedicine and the potential privacy risks? And by saying that, I don't want to discourage people from engaging with their doctor, of course, if they need to, but it is important to be informed.
Absolutely. So this is actually something where I think in many ways the fewest privacy issues have occurred in telemedicine here, because doctors already knew and practices already knew that they have requirements. There is a law that covers them. HIPAA has very strict security standards. And so, you know, unlike a lot of other industries, they were much better prepared to move practices online. This doesn't mean it's perfect, especially when it's been a less traditional kind of medicine. So something where they didn't have to file an insurance claim, the law didn't apply, and therefore they didn't know about the security standards necessarily. And so I would hear about, you know, people doing a Facebook session with a client because they asked about it, or holding a meeting on another platform that is really not secure, really not meant for that sort of confidential conversation. And so that's actually something where I can say, go out and engage with your doctor. Definitely ask them about security and privacy. But what I've overwhelmingly seen is that doctors are upfront saying, here are the risks, here are the benefits, here is how we have proactively decided to protect you. And so it's actually something that I think is a lot better off than many of the rest of us who have moved to purely online interactions.
One
I think
caution
that's
I
really
would make. Yeah,
I was just going to say one thing. I think your comment, Amelia, as somebody who's a privacy expert, I hope our audience finds that reassuring and feels that they can engage with their doctor, because there were privacy standards in place before all of this. It isn't new to our medical professionals.
The one comment I would make is that I think you're right that security in the medical world is pretty good. When you're home and you may have other people in your home, how loud you talk and how loud the volume is in terms of hearing your doctor could have implications if you, for whatever reasons, don't want to share information with family members. It could be something as simple as not wanting to frighten your children for them to know that you have a particular illness, or it could be something you don't want to share with your partner or other people in your home. So I would say one solution is to have a headphone which would allow the microphone to be very close to your mouth, and nobody in your home could hear what the doctor's saying. So that's just something to consider from a personal privacy standpoint.
I've also really appreciated the number of practices that are thinking about that, particularly therapists, psychologists, where perhaps family life is part of the reason that they are, you know, seeking help there. And they've offered things like chat therapy as a temporary alternative if you're in a place where you might be overheard. And so it has been really great to see, again, more than many other sectors that we've been dealing with, the fact that there really has been a lot of forethought and a lot of contemplation around both who is around us and are the tools that we're using to engage online safe.
Let's transition to something that has been in the news a lot, which are these tracing technologies. I don't want to say tracing apps yet, because just to clarify, Google and Apple have created the underlying technology, what's called the API, or Application Program Interface, for others to create apps that would help trace the location of people. Well, the way it would work is that you would have, if you had come into physical contact or close contact with somebody who was COVID-19 positive, you both had Bluetooth working, you both had this technology in your phones, there could be an indication, and you would get an anonymous notice that you had been in contact or in proximity with someone. You wouldn't know who it was. One of the things that I think concerns people is that these apps may very likely be issued by government agencies, by public health authorities. So we're not only talking about Google and Apple, which have long been able to track our location, but we're now talking about what some people are very concerned about, the government having access potentially to information about where we are and our medical status.
Absolutely. No, it's It's a really, really difficult issue. Like I said, there's been so many privacy advocates and agencies working almost exclusively on privacy who are like, I would have never allowed this 3 months ago. So it really does show how circumstances can change and how the context of why we're sharing information matters so much. It's not just, do I want to give the government my location? It's, do I want to give the government a rough idea of my location for the purpose of preventing, the people who came into contact with me or anything like that from, not knowing what was going on and whether they had the virus. So that's been something that's been really, really tricky for people to sort out. What I think a lot of people don't know is we've seen a lot of reporting about the contact tracing apps. We've seen reporting about sort of maybe thermal imaging in public places in our future, but we really haven't seen the broader discussion of the fact that these are only two of the many technologies that we're likely to start seeing adopted in public and work and school. And some of them aren't going to be like an app where, you can choose to download it or not. Some of it will just be information that is collected from us and we may or may not know about it, which isn't a great privacy or transparency practice.
Yeah, I just have a comment on that, and I'm sort of putting my lawyer hat on now. And I mean, you practice in the law a lot more than I do, even though I have the license, but it's making me think it's likely that these tools that are tracking us will be implemented before the laws are passed to guarantee that the information will only be used for a specific purpose and not, for instance, something that could be used in a criminal investigation of a person or something that could be used in order to, identify a person for a different purpose. And so, like, what do you think are the timelines, and, how long will it take the law to catch up to guarantee that this information, like, I think a lot of Americans are thinking, I'm willing to share this information for public health purposes, but I'm not willing to share it if down the line it ends up leading to, me being involved in a police investigation.
Yeah, I mean, that's exactly the right point, Kerry. And I think this is where the US is going to differ from a lot of the other countries that are adopting things, because most other countries have sort of a fundamental setup of privacy rights that apply to everything. Whereas the US has privacy rights that are centered around certain things, like HIPAA is like when you're billing insurance, this is what applies. FERPA is when you go to school and the school stores data, it applies to that data. COPPA is when collecting information from children under 13 and you're an internet provider, this law applies. And so that's something where I think there is an incentive for Congress and state legislatures to pass something quickly that does protect privacy, that does limit the uses of this information in order to incentivize people to take part in it. But it does take a long time for these things to happen. And so part of it is going to depend what pressure, all of us put on the government to say, yes, we want to help with this, but please limit how this data can be used first.
Yeah.
If Apple and Google follow up in terms of what they're promising, then the data that's collected via these apps that they're developing, or the technology they're developing, will be fully anonymized, and no one, including the government, will know the actual name of the people involved. They will simply know that person X and person Y were in proximity, but we won't know what X and Y stand for. However, there are so many other situations that I can imagine at work, at school, in the neighborhood, at the grocery store, where I might have a real good reason to want to know if Susan over there is COVID-19 positive, because I might normally have reason to come into close contact with Susan. And if I know she's positive, then I'll make sure that I avoid her, that I wear an N95 mask, or that she wears a mask. If I don't know, maybe I won't take exactly the same precautions. So these are conflicts. She has a right to privacy. I have a right to protect my health. How do we resolve those rights?
I mean, there's no way to resolve it so everyone is 100% happy. I think this is where the contact tracing apps really are trying to strike a balance of you get to know that you ran into someone who tested positive, but you don't get to know who it is. And that may frustrate all of us who like, watching next door. But it is a good way to sort of balance out the privacy rights versus the health rights there. The key really is, where we go, not right now so much, but where we go does tell people a lot about us. Mm-hmm. And it's very easy to re-identify people. There was an amazing story in the New York Times right around Christmas where they were able to recreate people who were in the CIA and the Secret Service and, kids who were going to school, just based on sort of where they knew certain people were going to be, and then taking those couple of locations to see the other locations they visited. This is a really tricky area, and we need to make sure that the appropriate privacy protections and security protections are in place.
So just one comment is the tracing apps are sort of an after the fact situation where you are informed that you were exposed. What I was referring to is really more the prevention of exposure. So for example, if a student is COVID-19 positive and they're asked to stay away from school, or if a worker is COVID-19 positive and they're asked to stay away from work, that's not 100% indication that they're positive, but it's kind of a pretty good clue to their fellow workers or students that this person is COVID-19 positive. And generally, we don't have necessarily clues about people's illnesses, but this could be one.
Oh, absolutely. A lot of what we've seen in the back to work or back to school plans that have started to be put out involve disclosures of pre-existing conditions, health conditions, whether you or a family member had the virus. And that's a whole lot more information than we ever provided to our boss or our coworkers or fellow students or anyone. And so there's going to be a really big question about how much people are willing to turn over that information voluntarily and trust their employer, their school, that it's not then going to be used down the line to, change their health insurance benefits or their opportunities in education. And I don't know that that trust really exists right now.
Yeah, I want to drill into some of the implications of what reopening schools might look like in a few minutes. But before we do that, I want to kind of look back on what's happened in the past month and a half for educators and students, and the creators of the tools that we depend on in order for remote learning to be possible. So some schools and districts, and I'm fortunate enough to be part of one, already had the tools in place to make all of this possible, and we had already vetted them for privacy, and our students and teachers were already trained on them, and certainly they're using them in different ways now, but it was a much different step up than training or introducing brand new tools to teachers and students. At the same time, a lot of ed tech companies saw this as an opportunity to share their tools very generously for free with educators and students to help make those connections possible so that education could continue on. As somebody who's kind of the lead administrator on technology at my school, I saw both the good intentions and the big privacy risks that came with all of these offers that were coming out there. I wonder if you could elaborate on that and maybe help explain to my colleagues why I was worried about some of those risks.
Absolutely. And I'll start out by saying that honestly, the ed tech companies went to the bottom of my list in some ways. Like I work on child and student privacy full time, and we spend a lot of time talking about best practices and what is allowed and not allowed, and the intricacies of their privacy policies. The biggest issue that I saw immediately after this was the non-ed tech companies stepping in and saying, here is our product for free. And you had systems that were not built at all to fit within the student privacy ecosystem to serve children. And people were hopping on, and teachers had no idea that these companies hadn't done their due diligence in advance to make sure that information wasn't being monetized, that kids' profiles weren't being created, data wasn't being collected that would be sold down the line, all of that. And I think the best case study of that is Zoom. They had the best of intentions when it came to offering their product to educators for free, But even though they had sort of this parallel education product, it was really hard to find. Why would a teacher know that they couldn't just sign up for the normal product on the homepage? And they had to sort of, I think I was getting like 2 or 3 news alerts every day about this senator sent a letter and this senator sent that letter. And now this school district has been banned from using Zoom. And that's not the sort of message you want to send to parents at your school, that you want to send to educators who are just trying to educate kids. And exactly the way that you mentioned, the districts who were prepared before this, who had done student privacy work before this, are the ones that are now really thriving in this online learning environment, and everyone else is just having a really, really hard time right now.
What are some, so now we've talked about the companies themselves, both the ed tech companies who actually, like you said, had done their due diligence before. So we knew that most of them were COPPA compliant and had considered under 13 users and all of that, and FERPA. What about, what tips can you give to educators? Because they're not accustomed to online teaching. And so they may unintentionally put student data at risk just by the way that they're, with, again, very good intentions, trying to connect with their students and share information with their students. What are some tips you can share with educators?
Absolutely. So I will go ahead and, be self-promoting for a minute, and I guess promoting you guys as well. We have the Educator's Guide to Student Data Privacy, which we put out, I think, about 4 years ago now, that still very much so holds up. My favorite is the last page that lists questions you should ask as an educator before adopting an app. It's really fantastic.
I use those questions all the time in trainings that I run. Like, these are the questions that you need to kind of remember when you have a new tool that you're excited to try. Yeah, they're great.
Exactly. And then the website that we run at FPF-FERPA-SHERPA.org has a whole section for educators. And we've also been developing a lot of tips specifically, as you said, on best practices around this situation, around online learning, why, using social media to provide, education probably won't work in many cases, or what you have to look at before you do that. So definitely take a look at those tools. I know Common Sense Media has been doing a lot. I've been telling people to rely on their privacy evaluations. But yeah, it's mostly about asking those questions. It's about really zooming in and examining, is it an education product to begin with? At least then, you're all starting from the same understanding that we need to protect kids, and then asking the other questions in the Educator's Guide.
I'm really glad you brought up the guides. And by the way, if you go to ConnectSafely.org and click on the All Guides link in the nav bar, you'll see an educator's area and a parent's area. And there are guides in both. There is the Educator's Guide to Student Data Privacy, which, by the way, Kerry did a fantastic job co-authoring. And then there is the Parent's Guide to Student Data Privacy, which, of course, is focused more towards parents. So both are important. I want to bring up one other question about education. I think Kerry may have some follow-up ones, but schools don't live in a vacuum. They are part of a political process. There is an elected school board, and even beyond the school board, or there are city councils and state legislators and a lot of people who have a lot of things to say about how schools operate. Whether they have the authority or not, they certainly have plenty to say. So given the fact that there is this kind of political ecosystem surrounding schools, how does that impact some of these privacy questions that we're struggling with?
It's a really good question. Honestly, at least K-12 wise, certainly there will be plenty of opinions, but I haven't seen it play out quite so much around K-12 schools as I have about the impact if those schools don't open.
Right.
The fact that so many of us have kids at home and won't be able to go back to work even if things do open up, if schools aren't open, or some further accommodations will be required. And that's really where this gets tough, because on the one hand, you don't want to send kids to schools, which they were bringing back a whole lot of viruses prior to this. But on the other hand, you do need to figure out what you're going to do for childcare. You do need to figure out what you're going to do to prevent sort of the concept of summer melt that is now, I guess, March through whenever schools open melt, where kids lose a lot of what they've learned and have to reestablish that. And it'll disadvantage a lot of kids, especially those whose, parents may be working 2 or 3 jobs right now, having to leave the house and don't have time to sort of homeschool them, as it is often called these days on social media. And so there are a lot of equity issues. There are a lot of substantive, making sure families are financially stable issues that'll play into all of this.
And also my teachers. My daughter is a kindergarten teacher at a private school, and she normally teaches summer school, and they will have a summer school session this year. And she has said to me that she is not sure she's willing to go back to school, the physical school. And if she decides not to, I don't know what that'll say about her career situation. So it has a huge impact on people's livelihoods as well.
Oh, I've heard a number of folks, both K-12 and higher ed, who are just like, if my school reopens, I can't go. They may have a pre-existing condition. They may have their own kids at home, whatever it may be. And they don't think it will be safe. And so when we have these conversations about reopening, the question is, how many people will be willing to participate in reopening if it does happen and people don't feel reassured that they or their family aren't going to get sick.
And that brings up privacy implications as well, because again, it will be very obvious to her colleagues and the parents and students if she chooses not to go back to work, and people will speculate as to why. So it brings up privacy as well as so many other issues. Kerry, I know you've got some more questions about education, and you better than I to ask education questions.
Yeah, and as an educator, there's just a couple of comments that I wanted to make that I just can't help myself. It's really a mistake to call what's happening homeschooling, because there are people who are homeschoolers who do curriculum planning. They have whole portions of their home set up. They're part of homeschooling networks, and they do some co-teaching and sharing. And what we're doing under these emergency circumstances is not what they do as homeschoolers. So it does a disservice to that branch of education. Also, this is not online learning, because your normal classroom teachers are not trained in online learning. That is also a whole branch of education where people are professionally trained. We may end up moving toward online learning next year if we have to, but that will take some capacity building. And that's really on people like me who are school leaders to make sure that I'm providing professional growth and learning for my teachers so that they know how to do online learning. So I saw a meme recently on social media that said, hey, medical professionals, the politicians are telling you how to do your job. We hear ya. Thanks, teachers. Because for decades, politicians have been trying to tell teachers what they need and what they don't need in order to do their jobs. And it feels like the same thing is happening to medical professionals. And while what's happening to them is like life and death for patients, it's tough, like you said, Larry, when politicians are sort of making decisions that can really impact the quality of the work that you can do. So,
Kerry, what you're saying is absolutely true, but I do have to make one comment. I know that you are not trained to be a television presenter, but that's essentially what you're doing right now. I was never trained to repair washing machines, but when we had a problem with our washing machine last week, rather than take a risk of having a technician come into our home, even if we could have found one, my wife and I figured out how to fix our own washing machine. And so we are learning things that we may never have thought we'd ever have to learn as a result of this.
Yeah,
and
that's
Kerry,
so
I want to add to what you were saying. I think we cannot emphasize enough, especially for any parents who are watching right now, we cannot emphasize enough that what is happening in this moment is a response to an emergency. It is not normal, whether ed tech is valuable or not. It is not online learning. It is not, normal homeschooling. Like, all of these things are so crucial, because I've been really sad to see that a number of folks are just like, well, ed tech is bad now, we've proved it. It's like, no, it's a tool like any other. And when you are, in an emergency situation where no one has, there's a Common Sense Media survey that said 15%, just 15% of educators had training in providing online learning. And when you're in a situation like that happens so suddenly in the middle of a semester, you're triaging, you are not able to provide substantive learning. And so I think the most important thing is going to be to remember, as the memes on Twitter tell us, this is not normal. We are working in an emergency situation, and we shouldn't make conclusions based on how good or bad anything is going right now, as to whether we'll, potentially go remote in the fall or something like that.
Yeah. I'm going to just push back slightly. I mean, you're absolutely right. But if you think back to World War II, we as a nation learned that women could be great in the workforce. And prior to that, women rarely had jobs in manufacturing. Now, it took another 70 years or so before we began to actually implement that after the war. But there will be some things that we're going to learn from this that we're going to say, hey, that's working pretty well. Like, for example, Twitter yesterday announcing that if people can and want to work from home, they can do so forever, permanently. So there are some aspects of this, but you're absolutely right. I don't mean to disagree with the fact that we should not judge the quality of online learning based on this any more than we should judge the quality of network television based on Zoom webcasts. I mean, we are doing what we have to do to get through an emergency. We're making a lot of compromises, including privacy compromises, which is fundamentally the subject of this podcast, this webcast. But at the end of the day, we at some point are going to go back to, quote, normal. And I think that we will have taken some lessons from what we've learned during this period, but other things we're going to be really happy to go back the way they were, and maybe forward to things even better.
And I really hope you're right. And honestly, the biggest takeaway that I hope is that more districts are able to focus on privacy, focus on online learning, provide professional development, that they are provided the resources, the funding to do those things when it's not an emergency situation. I hope that's what we carry forward here, because there is such a big discrepancy between those who sort of had pre-existing programs and vetting of applications in place versus those who are just trying to do this on the fly.
So we're running really low on time. I have one more question for you. This happened to me 2 days ago. My daughter was on a FaceTime call with one of her friends, and she's in middle school, and they were talking about something, and I overheard her friend saying something about, yeah, your mom is weird, right? About me. And of course my ears perk up, right? But normally, like, I wouldn't necessarily hear all of her conversations with her friends, and she and her friends deserve some privacy. So I had this moment of like, ooh, I'm going to ask her what that was. And then I got my wits about me, and I have not asked her, you know what I mean? Like, her friend is allowed to think that her friend's mom is weird because I'm not like her mom, right? So what are some of the nuances of even privacy among families, the boundaries that have been broken, that I think we could maybe remind ourselves to kind of keep in mind and be patient about?
Absolutely. And this sort of relates to a trend that we've been seeing, which is the explosion of parents signing up for monitoring software now that their kids are home, because they feel there's more of an obligation to know everything their kid does online. So research consistently shows that the most important thing to child development, to, helping with any social emotional needs, any mental health needs, the most important thing is having a trusted adult that you can talk to. And that could be, a parent, it could be a teacher, it could be whoever. And so what we have to look at is what builds trust, what undermines trust. And if you're, were you listening at my door, Mom? Geez, I feel like you violated my privacy. Like, violating privacy has concrete consequences, even if it's unintentional. And that can undermine trust between, like, you and your daughter, or others. If you're doing sort of automatic monitoring, it's creepy if your parent comes to you and said, you were doing this thing on this website, or you said a bad word in your chat with your friends last night. Like, that just feels weird. And the inclination is probably to find a way around that monitoring. And so in this time where we're all getting on each other's nerves, how do we enable you to be that trusted adult in your child's life, which might be, hey, I overheard this thing. Do you want to talk about it? Or I can pretend I didn't hear it. But it might also be just acknowledging that we don't have privacy right now and pretending like we didn't hear it at all.
I agree with you about a trusted adult. I also think there's such a thing as a trusting adult. And I think that's what Kerry was demonstrating by trusting her child to process that. And Kerry, if you're weird in a really good way. So
thanks.
I like it. We do have we're going to wrap up. We do have a question from Facebook from Akram and asking, the pandemic is pushing education to change. Going forward, do we get into the mind of embracing internet education? And either one of you can answer that question, starting with Amelia, of course.
Interesting. So one thing that I really want to emphasize is I've sort of seen on the tech side with the companies that I work with, and even with some districts, with the tech staff there, this belief that this is finally proving the value of, online learning and ed tech. And as we were talking about earlier, no, this is an emergency. And in fact, what's often happening is parents looking at this and going, my child is having to learn calculus on their own. This is horrible. I don't want this to be in school when we go back to, normal. And so it's really important to sort of get out of that bubble and realize that there are a whole lot of people that, as opposed to thinking tech is really great because we do really need it right now to interact with our peers, our family, but people aren't taking that as a sign that, we need more innovation in education. Many of them are taking this as a sign that tech kind of sucks. So be aware that you still need to prove the value of tech and data use and all of that in education and broader than that, because there are many people who are assuming that what's happening now is, proof that tech is good or bad.
Yeah, and I have a comment to follow up, because to me, innovation is not equivalent to tech, right? Like that's not really what innovation is. A new way to do something that no one has ever done before. So yeah, I think we are going to have to innovate, but the ways that we're going to have to innovate is not about a new tool or a new app. It's about, we're going to have to innovate how we form meaningful, healthy relationships with our students so that they trust us to teach them and they're able to learn and engage in cognitive processes that result in academic success. So it will be, yes, we will have to innovate, but it should be based on proven, long-standing research around how educators and students interact for the benefit of the students and their cognitive engagement. So great. So I know, as I mentioned before, Larry, we're running out of time. I wanted to give you a chance to wrap us.
Yeah. Well, I want to thank both of you, Kerry, as always, and Amelia Vance from the Future Privacy Forum. Thank you so much. These are such important issues that we really need to focus on, not just today, but going forward. And just to let people know that this webcast and podcast are going to be archived. You can always go to ConnectSafely.org/live and view the webcast. And of course, it's also syndicated to all the usual places that podcasts go, the audio portion. Again, thank you, Kerry, and thank you, Amelia.
Thanks so much for having me. This was fun.
Thank you so much, Amelia. This was great.